Hi, Tara. How are you?
I'm good. I love the fall. Even though I'm a summer girl, Gina, there's something about the fall, the smells, the clothes that we get to wear. I love it.
The pumpkins and the boots.
Yes, yes,
I just
yes.
discovered I have a serious shoe problem.
You
I
just
moved.
discovered.
Well,
Okay.
I moved, and so I'm like, oh my God. So I was like, oh, I fit them all in in my rack, and then I realized there was a whole nother bag. So anyway, but I say this. I think I've said this the last two episodes that October is my favorite month of the year for many reasons. But one in particular, Breast Cancer Awareness Month, obviously. You've heard all about my story, and we've had some really great guests on here talking about their stories. And today, I'm really, really interested to hear our guest. She's kind of a big deal, number one, and number two, she is on both sides of the spectrum. So she's a breast surgeon and a survivor and an author. I am so excited to dive into today. Who do we have?
Well, we love big deals.
Us.
Our today's big deal is an amazing woman, Dr. Liz O'Riordan, who's coming to us today from the UK. Dr. O'Riordan is a breast surgeon, an author, a speaker, but today we're focusing most importantly on her journey as a patient. So welcome to the Welloff Podcast, Liz.
Thank you for having me.
A
Thank you
pleasure.
so much. And you've done a TED Talk I just was reading about. So you are really a big deal. So tell our listeners who you are and a little bit about yourself.
So I live in England in the middle of the countryside with my husband and a dog. And I always wanted to be a surgeon when I was little. And it took 20 years of training, but I finally got there. I was a breast surgeon, reconstructing breasts and making nipples and hiding scars. And I loved my job. And then 10 years ago now, actually, almost to the day, I was 40. I never checked my breasts because I'm not going to get breast cancer. I'm a surgeon. I saw a lump in the mirror. And that was a stage 3 breast cancer and the start of my breast cancer journey. And within 2 weeks, I went from being a surgeon to having every treatment I gave my patients. Chemotherapy, the surgery, the radiotherapy, the hormone blockers. And I've had 2 local recurrences in the last 10 years. So touch wood, I am cancer-free at the moment, but I've lost an awful lot. My career, my fertility, my femininity. I had no idea just how much breast cancer impacts your life.
Wow.
It's uncanny, isn't it?
Yeah,
Oh, wow. I don't even know where to start.
there's a lot.
Let's start with how you were a surgeon and kind of what you saw with your patients, and how, you help them to kind of heal.
I think I'm the doctor nobody wants to see because everyone in my waiting room is paranoid and terrified they've got cancer. And
Mhm.
most don't. 95 women I see in clinic don't have breast cancer. So it's all happy smiles
Oh,
and
wow.
faces.
That's
But they
great.
never want, it's great, but they never want to see me because everyone imagines the worst.
Mhm.
And it's awful when you find cancer in someone because most of us don't have any other symptoms. We feel well. It can be a real shock, especially if it's come through screening. And it's a real honor and a privilege to hold their hand and walk them through that journey and make it as friendly is the wrong word, to make it not scary. And the way breast surgery has changed, we can now hide scars around nipples and we can reconstruct the breast so you can leave the hospital looking as good as you can considering what's gone on. And I love that. And I'd get women flash me in shops showing me their boobs in the supermarket saying the freezer aisle, look, you can't see the scar. And it was lovely being able to give them something back when they thought they would lose everything.
Yeah. No, and I have to, obviously, speaking from personal experience, I don't look at my breasts. I had a double mastectomy and I have 3D nipple tattoos from the amazing Lana, but I don't really think of them as actual breasts anymore. Like
No,
if someone wants to see them, I'm just like, yeah, here you go. And
exactly.
it's not a big deal to me. I mean, you actually have a statue of yourself in your hometown topless. Oh my God.
I
Tell us
do.
about that.
So I just finished treatment for my second recurrence. And in the UK, there are more statues of goats and more statues of men called John than there are of women. It's true. It's true. It's crazy. This charity reached out to the general public saying, right, we want to change this. We want you to nominate inspirational women. And they took 30 of us and they created about foot-high statues that were 3D printed. And there's one of me and I'm in my surgical scrubs. And I've got, because I was doing triathlons at the time, I've got my bike helmet covering my nipple, I've got my medal, my bald head, and it now sits in the library of my local hospital. It's amazing.
Amazing. Amazing.
That's so beautiful. You know, Liz, I'm listening to you and I'm in awe because I would imagine that, like you said, you were a breast surgeon and just never thought that would be your story. But stage 3 is pretty far down the line, and I know here we're always preaching about self-exam. So help me to understand how it got that far.
I will do. So I'd had a couple of cysts in my early 30s when I
Mm.
was screaming on the sofa thinking I'll be dead in a year. My husband, my fiance at the time won't marry me. That horrific, it's the end of the world. And it's just a cyst, which is very, very common in your late 30s and early 40s. I never checked. I had lumpy breasts. I think you think you're invincible. You think it's never going to happen to you. And it's only when someone is diagnosed, like Nicola Eggert at the moment, you'll give yourself a quick feel. I saw a lump in the mirror and it looked like a cyst, and I wasn't worried. And I had a mammogram and that was normal because I had dense breasts. And then they did an ultrasound and they saw it. But I had two types of breast cancer. I had one called ductal, which is the common one that we can see easily. It forms a lump. But I also had something called lobular cancer, and that affects 10% of women. And lobular cancers grow in sheets. So you can't see them and you can't feel them. It's like they infiltrate the breast. So even though the lump I could feel disappeared during chemo, after my mastectomy, there was 13 centimeters of lobular cancer left in my breast, and it had spread to the lymph nodes.
Wow.
But if I checked my breasts every month, I would have found that lump at a much smaller stage, and it might not have spread to my nodes, and I might not have needed chemo, and I could be in a very different place now.
Thank you for sharing that.
Yeah. I mean, that kind of leads to my next question. What do you wish that every woman should know? Like, you look back and I do the same mental
Yeah.
thing that you're doing. Like if I would have just the first time, what is your advice to women now who are just doing their, breast exams? But I know there's a lot of anxiety and they don't even the other day I was doing mine and I just like, I kind of like, I don't really want to do this because I don't want to find
Yeah.
anything.
I think we're all scared because we think breast cancer is scary and social media is full of young women dying. But actually, very few young women get breast cancer. It's more common in our mums and our grands and our aunts. It can happen to anyone. And if you don't check, you won't know what's normal for you. And if you're too young to have mammograms, you need to check, and it can still happen between screening. So breast cancer may appear between your two mammograms. It is the only thing you have to find this earlier. And the earlier you find it, the less treatment you're likely to need and the better your chance of a cure. It's really important. There's a great charity in the UK called Copper Feel, which is our slang for grabbing hold of someone's boob, Copper Feel.
Oh,
And it'll
Copperfield,
send you,
I thought you said Copperfield. I was
So did I.
like
Copperfield.
but cop is in grab, Copper Feel. And it'll send you a text reminder on the 1st of every month to remind you to check your breasts. Just put an alarm in there. But at the same time, check your pee, check your poo, get a mirror and check your genitals. Think of this as your general monthly overhaul. Is there anything new that needs to be checked out?
What should
Such
they
a
be
great
looking
reminder.
for? What should they be looking for in their pee and their poo?
So we know if your pee is red, if there's blood in your wee, that could be a sign of kidney cancer. If your poo, if there's blood in the poo or coating the poo, that could be an early sign of bowel cancer. There are lots of people in their 30s and 40s thinking it's just piles or bleeding hemorrhoids, but it could be colon cancer, and most of us never check. So just kind of do a once over every month. How am I feeling? Do I feel all right? And if there's anything, you get it checked out, because the earlier you can catch this, the better you're going to be.
Amen. Such a great message for our listeners. So Liz, I'm curious, you said the obvious. You lost your fertility, which is something that so many women have to accept after going through this trauma of breast cancer. But you also said your career.
Yeah.
So tell us about that.
So I had a year off in total for my treatment, and I went back to work, and that was really, really hard. The job's hard enough already because you can feel like you're being paid to make women cry. When you're telling 10 women a day they have cancer, it's come back, they need more surgery. You absorb all that emotion, it's really hard. But doing it this time, it was like PTSD. I would see the women I was telling had breast cancer just crumple. And I was like, that's how I looked. I'm reliving my own experience of getting bad news. And when I was operating, I thought, I don't want to cut you open because it might hurt, because I know how much it hurt. And it took about 6 months for me to, I guess, get a mask, be able to put Liz, the patient, behind the surgical mask and just be Liz, the doctor. And that was really hard. But I've been back at work for about a year and I noticed a lump underneath my armpit that I just thought was scar tissue. I was having my implant removed because radiotherapy had turned it into a really tight, painful tennis ball. I was swearing in public when I got muscle cramps. And she said, let's just scan this. And it was my first recurrence. And because I had more surgery, more radiotherapy to my left arm, it didn't work as well. I lost the power in my shoulder. I couldn't operate. Physically couldn't do the job, but psychologically I was a mess. I thought I can't deal with breast cancer having had a recurrence. And I had to walk away from my career age 43, and I lost my independence and my income, and I was suddenly home alone with no kids thinking, what do I do for the rest of my life and how long do I have?
Wow. But you are such an inspiration and someone who's just the perfect fit for the Welloff podcast, because I feel like we meet so many warriors that turn the proverbial lemon into lemonades. And so now you have pivoted and taken this and used it to be a speaker and an author, and you are healing still.
Yeah, I think deep down, all I want to do is help people and birds and animals and any waifs and strays. But it's that helping people. And I thought I need to find another way to do this.
Yeah.
And I started a blog back in 2015 because some blogs are quite scary. We tend to exaggerate, you know, the clickbait, but actually let's give you the honest middle of the road. This is what it's like. And I've realized through my writing, I can reach doctors and nurses as well as patients because they'll listen to me because I've been on both sides. So I talk all over the world to healthcare organizations about how to improve cancer care and what the little things you can do. You don't know what your patients need, but I do. You don't know what we're Googling the minute we leave the door. But I can also make it less scary for patients. And by writing, so my latest book, The Cancer Roadmap, explains what cancer is and debunks all the myths, all the stuff you see on Facebook and TikTok. This is what it is. This is how to read the science. And it's amazing because you can reach 1 million people all over the world with a video compared to the 100 women I might see in a year with cancer. And it is almost more rewarding than it was being a surgeon.
I love that. Kind of going back to the radiation, maybe coming from the doctor's standpoint. What are your thoughts? You know, I had radiation and I felt like the radiation side effects were worse than anything else. Like you said, like they shrink the implant. It's hard. Like I can't do chest exercises anymore. Like I have tightness in my left arm. If you had to do it over again, would you still do the radiation, or what is your views on that?
So generally, if you have a lumpectomy, you have just the cancer removed, you need radiotherapy to treat the rest of the breast. Some women who have large cancers with a mastectomy still need radiotherapy, but you often don't know you need it until the cancer's out and we find it's much bigger than it was. So often we can't predict it. And that's when you can get quite bad scarring and damage. And radiotherapy I found it really emotional. Lying topless with my arms above my head, all the feels. I thought that's why I just felt really, really vulnerable. And the side effects are long lasting, and we can't predict who's going to get bad side effects from radiotherapy. It doesn't matter how big or how little you are. It's just one of those things. I would do it again because I know it would have worked, but it's not fun. The thing I have found that helps actually is lifting weights. Now I'm in the gym like with a 1 kilogram weight with my really weak arm, but I slowly build up. And actually when I'm doing the exercises, it does start to release all the tight muscles, but you feel like an idiot because you're there with like this tiny little weight, but that's what you've got to do.
I foam roll, like I foam roll it out because it's like the cording and there's all these things. But we've talked to previous guests who, opted out of radiation and chemotherapy and kind of went the natural way of healing. And so,
so I get the appeal of that, especially in the States when it can cost an absolute fortune. But I'd just love to say, we know that women who opt out of traditional treatment for breast cancer and go down the completely natural alternative route are 6 times more likely to die.
Wow.
If you have surgery, that helps because it removes the cancer, but the things we give you to reduce the risk of recurrence, they're horrible. They have side effects. The collateral damage for life was there. But if you choose to go down the alternative route that isn't evidence-based, your cancer is 6 times more likely to come back.
That's a sobering statistic. Now,
it is.
Liz, you mentioned that you like to debunk myths. So what do you think are the biggest myths that are out there about breast cancer?
There's so many.
Okay, so the things that the biggest causes of breast cancer are getting older and being a woman. Basically, when you're 30, your risk of breast cancer is 1 in 200 women. When you are 90, it's about 1 in 2 women. So it's cancer
Wow.
is a disease of disease of, you know, the
Wow.
longer you, that's why we don't start screening until you're 40 or 50, because that's you get older. And women have much more breast tissue than men. Other things that increase it are having dense breasts. And that's when you're young, your breasts are dense because that's a tissue that could produce milk. You can't do anything about it. It slightly increases your risk. We know that alcohol increases your risk, but just by a little bit. We know that being overweight and not exercising regularly increases your risk just by a little bit, but it's there. Those are things you can control. The things that don't increase the risk of breast cancer are deodorants. People think the deodorants block sweat glands and stop toxins draining. It's nonsense. It is absolute nonsense. They are
Liz,
safe.
you just gave me a gift
Oh my
because I
God.
have been using natural deodorant
Same.
and it doesn't work. I feel like
No,
I smell in an hour.
you don't. Deodorants are safe.
I'm
We ask you
buying
to
regular
use,
deodorant today.
What
we
about
ask you not,
aluminum?
it's
Aluminum safe?
fine.
It's fine?
Yeah, you don't. So there was a study that looked at breast cancer cells in a lab and said, oh, they have aluminum, therefore it's being absorbed, and aluminum can cause cancer if you eat masses of it. But they did look at it in people. Aluminum, you don't absorb it through the skin. It's fine. It's absolutely safe. We ask you to use natural deodorants after radiotherapy because the skin is so sore, they can sting and burn. We ask you not to use them before a mammogram because the white flecks of aluminum can confuse a reader. Deodorants are safe. Another thing, underwired bras do not cause breast cancer. People believe they press on the breast tissue and stop toxins draining. It's nonsense. Another big thing doing the rounds is the phytoestrogens and parabens in our cosmetics and makeup. And I know Sephora has huge aisles of clean cosmetics. Again, it's nonsense. Yes, there are preservatives called parabens in our cosmetics, our makeup, that help them last longer, that stop bacteria and fungi growing in our moisturizers. Think just how clean is your finger when you're taking a swipe of face cream to put it on your face. You absorb about a thousandth of a percent of these parabens into your skin, and they are 1,000 times less effective than the pill at regulating your hormones. And the pill has a tiny, tiny increased risk of breast cancer. So clean cosmetics is just a marketing scam to make you buy stuff you don't need. They don't cause breast cancer.
This is amazing information.
I know. I'm like, what?
Seriously.
I literally had to go like, no paraben shampoo, no paraben.
No, it's nonsense. And now there are people saying put vaginal estrogen cream on your face to make it look better. But then they're saying don't use, you know, Estee Lauder because it might have parabens. It's nonsense. It's completely safe. And I talk about more in my book. The other thing though is things that cure cancer. And I spend a lot of my time doing this. The apple cider vinegar documentary, did you see that about Belle Gibson? She was an Australian who pretended to have brain cancer and became very close friends with a girl who had an awful bone cancer in her hand. And she went down the juicing, Gerson therapy, colonic enemas route, and she died. So juicing, colonic therapy, keto, the alkaline diet, nonsense. I call it nutribolics. They don't cure cancer. Sugar doesn't cause cancer. Starving sugar just starves all of you. It doesn't stop cancer coming back. There is no magic diet. There is no magic supplement. Vitamin C drips and turmeric just end up down the toilet. Save your money. We want a quick fix. And I get it because I'm sure you get this, Gina. You're vulnerable and you're scared and you're desperate for control. And
you'll do whatever it takes to
and you'll spend whatever it takes.
Yes.
And the thing is, as a doctor, I can only tell you you're cured if you die of something else. But you get a guy on TikTok and Facebook, hey, I've cured all these people. With AI, the testimonials could be fake. They don't follow you up. You do the testimonial the day after you get the drug. They may not even be taking it and being paid to do the testimonial. You can't believe what you see online.
But you know what they say, you know,
yes.
It's all about, they say you should do this and they say you should do that.
That's right.
Exactly.
Who
and
are they?
when you go into so matcha tea is another one. People saying drink matcha tea and green tea. The chemicals, if you were to get the same dose that they gave these breast cells in a lab, you would have to drink 200 cups of matcha tea in one sitting to get that equivalent hit.
Wow.
But there's a study.
Cups.
It's crazy.
And you know, we represent two dynamics here because Gina has gone through the trauma and ordeal of cancer. I have had all the scares. My maternal grandmother had breast cancer. I've had biopsies in my 20s. I have dense breasts. I just had a scare at my last mammogram with ultrasounds, and I thought for sure, this is it. It's my turn.
Yeah.
So we'll do anything
Yeah.
to
Yeah.
prevent it from
Exactly.
coming back. So
Yeah. And the thing is,
interesting.
the things that do reduce the risk, they're boring, they're not sexy, they're not exciting. It is exercising 5 times a week. It is cutting back on alcohol. It's trying to maintain a healthy weight for your size. They are proven to reduce the risk, but they're not making influencers money on TikTok, and that they feel like they're hard to do.
Wow.
So,
Well
so that
said.
so that would be your advice is, I mean, try to eat healthy
Yeah.
and work out and get your sleep and take your vitamins. Like, what about the vitamins and all of that? I know
So
Tara takes about like 32 vitamins a day.
I think if you can afford to eat a healthy, well-balanced diet with a rainbow of fruit and veg, then you don't need vitamins and minerals. But a lot of us can't do that. We don't have the time, energy, money. It's a luxury to be able to eat healthily. So if your diet isn't always fruit and veg, then I think a general multivitamin supplement is absolutely fine to top you up. I don't think you need fancy supplements at massive doses. I'm not a supplement taker. That's not me. But if they make you feel better, and it may be I take my collagen supplement to make up for my bad skin in the 20s because I didn't wear sun cream and I drank and I spent my life in nightclubs. That makes me feel better.
Me too, me too.
Yeah. And the thing is with collagen, you have no control over where your body puts it. It may put it to your skin, it may put it to your joints, but I digress. It's basically if those supplements make you feel better, so you eat better and you exercise and you sleep better, then the supplements are actually doing some good. We kind of call it the wellness placebo effect.
Okay.
Okay. I mean, I spend a lot of money and I do take a lot of supplements, but it helps my mind.
But that's good. If it helps you, yeah, I think
it makes me happy.
I don't take them because I can't afford them and I don't think I need them and I probably should. So it's personal choice. But if they make you feel better, then they're safe.
Thank you for
But if you've
that.
got cancer, you need to check with your doctor about all the supplements because they can interact with the treatment.
For
That's
sure.
really important.
Yes,
sure.
that's definitely
Especially
something.
turmeric and tamoxifen.
So
Interesting.
that was my next leads me to my next question. They have the hormone blockers. Talk about, you just did something on your social. She's very big on Instagram and TikTok, talking about, all these myths and debunking them. So we'll give you all her info at the end, but talk to us about tamoxifen, the hormones, and like the GLP-1s, because that was something you just talked about.
Yeah. So basically, 80% of breast cancers have lots and lots of estrogen receptors on their surface, far more than a normal cell. And what we do to kill them is to give you drugs that lower your level of estrogen. So the cancer cells can't get that signal like a traffic light going from red to green.
Right.
And what tamoxifen does is it stops estrogen attaching to the breast cancer cells. Other women are on drugs called aromatase inhibitors. So after the menopause, we make estrogen in our fat. They stop you making estrogen. So that's what they do. But there are certain drugs like
they also make you crazy. They also make you
crazy. It's an instant menopause. It is an instant menopause. It's not the 3 or 4 year thing. They ruin your sex life. It's everything. It's horrible. I hate them. It's horrible.
Oh yeah.
But a lot of supplements interfere with the enzymes that break tamoxifen down, so they can stop it working. But the GLP-1s, this is really interesting. I used to say, you don't put on weight on tamoxifen in the menopause. It's a myth because not everyone does. But I was wrong. Because most women, their metabolism slows down, they gain weight. Chemo can make you gain weight. And we're saying lose weight to reduce your risk of recurrence. So the GLP-1s, the Ozempic, the Zepbound, they're everywhere at the minute. And I think in the future, we may be saying these are safe for women to use to get the weight off, but we don't have 10-year data. And the estrogen positive cancers can come back 10 or 20 years in the future. So we don't know what's going to happen. We also know that they don't work as well in women on drugs like tamoxifen. On average, they only lose 5% of their body weight in a year, which is what you'd get from basic eating healthy and exercising, whereas normal people will lose 15 or 20%. And there are lots of counterfeit drugs out there and the prices are going up. So it's that long term. And when you stop the drugs, the weight goes back on again. It's really, really unfair. But you kind of need to think, do I think it's safe for me to take this? And do the exercise and eating healthily as well, because it will all add together.
So I have to say, I was hormone positive. I'm on tamoxifen, and the chemotherapy also caused plaque in my arteries. And so when I had a calcium scan, my number was abnormally high. So I went to a cardiologist, and the cardiologist suggested, and I was overweight. I was about 30 pounds overweight. And so he suggested that I start on a GLP-1 to get that weight off. And I lost 30 pounds over the course of a year. And I'm on a very small microdosing dose now just to kind of maintain.
Yeah.
But my numbers were slashed in half. Everything with this GLP-1 has been in a positive. So you're saying that, my experience was positive, but some people might not have positive?
Yeah, I think from what we know, it's a positive experience. And lots of my followers have said, I've actually lost a lot of weight. I think if you're slimish, if you've only got 30, 40 pounds to lose, you might lose a bit more than someone who's got 100, 150 pounds to lose.
Got it.
And I think it will end up being safe. It's just, we don't know what the long-term risks are. There probably aren't going to be any, because losing weight reduces the risk of recurrence. And it's how you feel. You didn't choose to suddenly gain a load of weight and lose your hair and get plaques, and it's not fair. And if this is something we can give to women to help them lose the weight, and it's monitored by your doctor and you're being checked properly, then I think it probably will be a good thing. I can't recommend anyone to do it, but I've had lots of people who've said this has been life-changing, because you feel like yourself again.
Yeah, 100%. I look at pictures and I'm just like, who was that person? I was also drinking like a fish, so there's that.
Liz, I'm curious about something, because of our age and I guess where we are in life, we do talk a lot about menopause
Yeah.
symptoms, hormone replacement, and I am on bioidentical hormone replacement therapy. And I know one of the biggest reasons why I was hesitant to start was because there were so many people that said, oh, well, if you take an estrogen supplement, you're going to get breast cancer. But then what was explained to me was that with bioidentical hormone replacement therapy, estradiol, progesterone, et cetera, that's not the case. So I'd love to hear your disposition on that.
So we don't have a lot of accurate data on the newest drugs. But what we kind of know overall is that if you take estrogen containing HRT for 10 years, then your breast cancer risk starts to go up a bit. The biggest reason we think women get estrogen positive breast cancer is their lifetime exposure to estrogen. So if you are taking estrogen until you're 50, 60, 70, 80, you're getting an extra 30, 40 years of it. So that does slightly increase your risk of getting breast cancer. We think the bioidentical ones are safer, and we know when women stop HRT, their risk drops back down to normal. We don't know what this is like on the latest drugs, but it kind of says, yes, go on HRT, but I'm not sure it's safe to be on it until you're 70, 80 or 90, because there are doctors starting women in their 80s on it. The menopause is horrible, and I wish to God I could have HRT, and I think it's a great drug to have to help you get through that time. But I think you'll have to kind of set a time, kind of 60, 65. Let's think about tailoring it off. I think that's really important. And if you are on it, it's crucial that you do check your breasts, because HRT will keep them being dense.
Yes.
They don't become as fatty as other women. I think it's a brilliant drug to help. I wish I could have it. It's horrible. I know my mum used to go into the supermarket every day just to open the freezer aisle and cool down from a hot flush.
Yes.
But again, you could say HRT may increase my risk slightly, but I'm going to exercise and I'm going to eat well. I'm not going to drink a lot, and that will negate that risk.
Okay. Thank you for that. By the way, I'm so distracted by your nails. They're really cool.
I know, they really
I love
are.
them. And your glasses. I love your whole vibe.
Oh, I had to work out how to dress, because I spent my
Yes.
40s kind of having chemo when I came out, and I'm not a surgeon. And I thought when I was 50, I'd be wearing twin satin pearls. I love your pearls, by the way. They're fabulous.
you,
I don't
thank
mean
you.
that kind of pearl.
Triple strand like the queen.
They're a bit Chanel-like. It's fabulous.
They are.
Thank you.
I've had fun reinventing myself and thinking I can be cool, and I can dye my hair blue, and I can wear crazy colors. And it's just been great.
I love
I
that.
love that. Yeah, I love that. So kind of to switch gears a little bit into the breast cancer treatment, how are you seeing this evolve over time? I went through my treatments in 2018, and I have friends that have gone through treatments recently, and it's totally different. How is it getting better?
So my first breast cancer book, The Complete Guide to Breast Cancer, was published in 2018, and we did a second edition 2023. There were 20 new drugs in that time.
Oh my God. Wow.
It is amazing, especially for the HER2 positive and triple negative. We are giving more people chemotherapy up front with more drugs to try and shrink the cancers. There are much more tailored options with like immunotherapy. But the biggest thing for me is being personalized medicine. We are now testing cancers for specific mutations. And if you have a mutation, we can give you a drug that targets that mutation. So instead of giving chemotherapy to everybody, we're almost like giving the right drugs to the right people. And it's just incredible. And I think the future is going to be even better than that. It's like you have this drug and this mutation and this cancer, that's what you're going to get. And people with metastatic cancer are now living 15, 20 years. There's talk of vaccines for HER2 positive cancer to make it a chronic disease when it comes back. The problem is the lack of funding that's being cut. We all know there are issues all over the world. And I really hope it doesn't happen, but it's changed. I don't recognize it. I think we're going to be using AI to help doctors work out which drug to give people because there are so many choices now.
It's crazy. That is crazy.
I bet you're right. So you mentioned a little bit about your lifestyle, but I'm curious, with all you've been through, what are some of your self-care practices, your daily routines that help you stay centered and healthy?
I'm going to be honest, I'm terrible at that.
I love honesty.
Working as a doctor was really long hours, and you put your hobbies and your life on hold. And now I volunteer from home. I don't get paid for half of what I do, but I do it. When you're content creating on social media, it can be like an 8 in the morning until midnight job. It's really hard to switch off.
Girls say less.
It's really hard.
We know.
The podcast, the writing. It's like, when is the time for me? And I think I'm realizing that I do have cancer and I am on drugs that have side effects and I need to break out time. So I'm trying to say 2 afternoons a week are for other people. The rest of the week is for me. And I love being in the garden. I love watching the birds.
Wait. Hold on. Go ahead, Tara. I know you want to say something.
No, my dogs are barking. You didn't hear them? Good.
No.
Good.
Okay, I'm sorry.
Daniel's fast asleep by me.
I have noise cancellation, so.
Okay, sorry. Go ahead. Say that again.
So I love being in the garden. I love feeding the birds. We have a big pond, so we have wild ducks that come and bring their ducklings. I've got into wild swimming. I did that when Mum died, and I'll go to the river and the sea all year round, even when it's freezing. I am one of those people, just to get that buzz.
I've never heard of that term before. Wild swimming.
So kind of instead of swimming in a pool, you swim in rivers, you swim in lakes, you swim in the sea, and we do it all year round. Not in wetsuits. We have kind of gloves and socks. Love that buzz. Exercise helps, and I do a lot of knitting and crochet, and I've just bought a spinning wheel. So that's kind of me being a surgeon. I'm doing something with my hands.
Yeah, I love that.
Yes. I'm a crocheter since I'm 9 years old. Yes, I love to crochet. But again, time. And I must say, I have like a little, I think, arthritis in my hands. So it hurts after a while, but I love it. I really do. It's so therapeutic.
Making stuff. And that's
making it, yes.
That's why I switched from crochet to knitting to kind of give my thumb a break. But you can make stuff. It's amazing.
It's beautiful.
I love that for you guys.
I know. Did you know that about me, Gina?
I was going to say I'm learning something new about you like every episode. I'm like, I
love it. I love it. Yes.
That's amazing. The one other thing I want to talk to you about is you do talk a lot about, intimacy after menopause. Yeah. And I know, cancer or no cancer, that is a hot topic with a lot of our listeners, after you start to get perimenopause and sex. Like, talk to us a little bit about that.
So I'd only been married a couple of years when I was diagnosed, and I was thrown into an instant menopause. And I thought my first night sweat, I'd wet the bed because there was just water trickling down my bum cheek. Oh my God, this is horrible. I missed spooning because I get hot flushes and night sweats at night. My husband can cuddle me for about 2 minutes and nope, go away.
Get off.
Too hot. I miss that. And separate duvets help, but it was that I don't feel sexy or attractive because I used to flirt with my long hair and my breasts, and now I don't feel I can do that, and it's not the same. And when you have no sex hormones and your vagina is like a tube of sandpaper, and you look at your husband but you don't get turned on physically anymore, you see a film that would normally make you go, oh my God, nothing, dry as a bone. It's really hard accepting it and explaining to your partner that you still love them and you still fancy them, but stuff don't work anymore.
Yes.
And I was married. It's even harder for women who are dating and going through this. I have learned there are ways. Talking helps before you get to the bedroom. Lube, everyone should use lube, but a lube that doesn't have a load of crap and glitter and is scented, just a normal basic lube. We should tell everybody. Vibrators and dilators, and actually you often need a stronger sensation to get an orgasm after the menopause because things deaden. There are some great air pulse vibrators which are really good. And dilators, you can buy really nice beautiful dilators to slowly stretch up the vagina because it's like a muscle. If it's not been used for a while, you can't get your little finger inside. So that can be something that you do, and it's almost like homework. And by connecting with yourself, you realize you can still feel pleasure, and it may not be spontaneous, but there are ways of doing it if that is what you want to aim for with your partner. But for me, it's been a lot of holding hands and massages and finding other ways to be intimate. But it's really, really hard because it's not fair. And I've seen marriages break up. I told my husband, divorce me and go and find a woman with 2 breasts and a healthy libido because of the guilt of what I felt I'd done to the marriage.
Hey, that's what my ex did.
A lot of people leave. And then you get men who are sleeping in separate bedrooms because they don't want to hurt their partner.
Right.
And they're scared of touching her or scared of catching it because we don't talk about it. I never talked about it. I used to tell patients, you get a bit of vaginal dryness and you'll be fine.
Oh gosh, no.
I had no idea. But no one told me.
Of course.
I had no idea. I mean, that's why I talk about it, to say it's shit, but it's real and there are things you can do to try and help.
Well, I applaud you for that, because hormone replacement therapy, was attractive to me, because when I went through menopause, that part of my life came to a screeching halt, and I wasn't ready for it. And I was so mad. And, luckily, because I'm a therapist, I do talk and I encourage talk. So I was very open with my husband, and, it didn't damage our relationship, and he didn't take it personally. But it's a really, really hard thing for a woman to go through, and I love that you mentioned your hair and your breasts, because we're taught right from such an early age, like, we are objectified in so many ways, but our sensuality is not about that. It's our essence and how we think. And so I would imagine it's like reorienting yourself to who you are and what sexy is and how to be attractive without the obvious, right?
Yeah. And I think I discovered it's what you lose everything that you'd give to someone transitioning. How am I still a woman? And then I realized, when you're a surgeon and you're operating, all you can see is the eyes between the mask and the hat. And whether someone's male or female, are they sexy, are they angry? And actually the essence is in you, and it can come out. And often, like, the sexiest moments you have are when you look awful, you've been gardening, you just kind of, I want you now. It's not what they're wearing, it's how you feel. And it takes a while to remember that and say, hey, it's still in me. I can still be this person. She hasn't gone. She just looks a bit different.
Such wisdom from you today.
I know, we're learning so much.
Dr. Liz, we ask everyone on our podcast the same question, and that is, what does Welloff mean to you?
I think it is being grateful for what you have and nurturing the connections you have with those you love.
Beautiful.
Yeah.
Simple.
Yeah.
And so true.
I think, well, shoes and handbags is still very important.
We know that.
Yes. Yes. We're big fans.
Yes. And jewelry. But when you get cancer, actually, it's the people you love, and you value having a body and being alive, and just those simple things. That's what I want to be remembered for in my gravestone. Not that I always had amazing glasses and handbags, but I was an amazing friend and mother and step gran and all that kind of stuff. And I think it's easy to forget what you actually have and what's important.
Absolutely.
Amen to that.
So how are you today? You said you're cancer free?
I'm cancer free at the moment. I'm struggling with the side effects of the drugs that I'm on. I get monthly bum injections. That's my form of tamoxifen, and I've got quite a sore mouth at the minute, but I'm cancer free. Long may that last.
Awesome. Congratulations.
You will be in our prayers for that to be so.
Thank you.
So, Dr. Liz, how can our listeners find you so they could follow this incredible wisdom and ask questions if they have it?
So probably the easiest place to find me is my website, and that's my name, liz.o'riordan.co.uk, and that's got links to all my social media channels, my email, my books. You can get in touch and ask me anything. I love hearing from people.
Love that. And what's your Instagram handle?
Instagram, I'm at O'Riordan Liz. And YouTube, where I have all my videos, is at Dr. Liz O'Riordan.
We will be following and checking that out. And thank you so much for sharing your story and for pioneering this whole breast cancer journey to everyone and helping. I mean, like we always say, if we could just help one person, we've done our job.
Thank you for helping people like me help people like you and your listeners. It really does mean a lot to be able to share the word.
It's a pleasure, as are you. Thank you
so
for
much.
what you're doing out there.